Hi, I'm Alice Hart-Davis and welcome to this week's Tweak of the Week. Now, I've come to the Cranley Clinic in London's Harley Street to try a new kind of minimally invasive laser skin tightening procedure. This is one that uses an optical fibre with a laser on the end. It's as fine as a human hair, and that's going to be put inside my skin to laser it from the inside to tighten up loose areas. And I'm going to see Professor Ali Ghanem, who is an expert in this technique. He's a plastic surgeon and he works from this clinic. And he's going to work on my lower face, the loose bits of skin around the jaw. And I think he may also be going to do under my eyes, but we'll see. So I'm going to grab my mask, then come along and we will meet Professor Ghanem and see exactly what he's planning to do. More about the Endolift. What exactly is it and how does it work?
As you know, we are all trying to return the arms of time backwards, and it's a kind of common knowledge that we start losing our soft tissue from fat to collagen from around the age of 30, when our stem cells are not able to replace what is lost and maintain our youth. So Endolift is laser technology and has been with us for a long time, and we understand that as a result we have both immediate tightening and a delayed progressive collagen production, which improve the thickness of the skin. It is, healthy looking, and as well as address the laxity that is associated with the volume loss.
Okay, so you pop the laser on this very fine microfiber wire under the skin and work on loose areas from inside?
Exactly.
Okay.
So basically we have a treatment zone which is decided according to the anatomical and the stage of laxity that the patient will come with. Arguably, wherever there is a skin, you can use this technology. Okay. However, the most common areas to be treated are the laxity in the lower lid, then the laxity in the festoon area, which is between the cheek and the malar area. Yes. So, and then after that, the cheek itself to eliminate the smile lines or the nasolabial folds. And then moving down the jowls to eliminate the sharpness between the marionette line and the jowls. Moving down the double chin or the excess of fat and skin under the chin, and also the excess of the fat and laxity in the side of the in the side of the neck, which will lead to reduction in the definition of the jawline.
So you can use it for either skin tightening or fat reduction or both.
Correct.
Because so what you're clutching some pens, which I think you're going to use to mark up my face, aren't you?
Yes.
So what would you see in my face that you would most want to treat?
If you bend your neck a little bit, you will see, you can demonstrate the skin laxity more in this area here.
And so, I see it coming down.
Yes.
In front as well.
So this is here your inferior jowl compartment, and this is your superior jowl compartment. I'm sorry. So basically addressing both will be to design a treatment zone that will go like that. I usually preserve the fat over the mandibular border because that gives youth. A sharp mandibular border is associated with aging. Okay. So then the laxity here will be addressed by this treatment. So this is the first treatment zone.
Right. And then would you go under my eyes as well?
So you have a very, very small degree of laxity here, and then certainly with Endolift that will avoid you having surgery. I mean, it's too mild to have surgery really for it. So it's bothering you certainly more on the left than the right. We can put tiny bit of energy there, and it will give you a little bit more of a downtime because here you have a very strong tissue. The swelling associated with the procedure will be hardly noticeable. However, in the lower lid, any little swelling will be very difficult to hide. So if you are prepared for a week of a lower puffy eye, so then certainly we can treat your lower lid too. If you want to avoid that, we can then choose to do it at a time.
I'd be quite interested to try and, lockdown.
Absolutely. So I'm just going to make the entry point. So now I will start with the eyelids. Okay, so now we're going to numb your cornea. Look away from me, please. Well done. Look up now. There you go. Well done. Good.
Wow.
That's not too bad.
That's absolutely fine. Is that because I've got anaesthetic around the eye?
Mm-hmm. Okay, and then look up. No. Yeah. Very good. Close your eyes. Very good. So you are now protected. Now I want you to, within your shield, try to think of looking up, as if you are looking up on your eyes. Are you okay, Alice?
Yep. I can feel a very slight pressure. Oh, yeah. That's okay.
So that's the laser energy.
Yeah.
Targeted on the skin.
Wow. I can feel like a very thin thread of something. So it seems almost more than damaging the existing collagen, like it's kind of destroying it.
It is like, what the aim is like if you have your very nice Wagyu beef, we are making it medium rare. We are not charcoaling it, we are just giving it enough energy to make, to contract it, but keep it alive.
Okay.
Yeah?
It's fine, interesting. I can feel just a tiny trickle of sensation as you're moving it.
Yeah, you could see the jawline well defined with the contraction of this area under the mandible, and then you could see here the bulging skin representing the skin laxity. So I'm very happy that I cannot see major bruising, even the lower lid. Open your eyes very normally. So there is, hardly any major bruising, which is great, and you responded very well.
Okay, so this is what I look like after a full session of the Endolift. I mean, you did 10 areas, didn't you?
10 areas. This is the full course.
Yeah, and so this is why, looking here, we've got swelling under the eyes, which you warned me about. So this will go on swelling for a bit. I've got to wear a pressure garment around my face to contain. You can probably see there's swelling starting in here and there. But I mean, it does feel so firm. Yep. That's what's really encouraging. And I've got to wear that for 4 or 5 days?
Yeah.
Okay. It feels tight. My eyes are watering from those laser shields. Those are probably more uncomfortable than the procedure. And then probably this will calm down the swelling and the tiny bit of bruising in about a week or so.
Yes.
And then the results will be coming through from 2 months, but really 3 to 6 months.
And it will become better and better up to 3 months, where we can see almost 60% of the results. Okay. Beyond 3 months and up to a year, you will continue to tighten,
and then it will last for about 2 years.
I would say that whatever we manage to reset the laxity to, if we manage to reset it by 3 or 4 years, you will start aging normally, but then that will carry you for another 3-4 years.
Okay, rather than leave you with that particular image, I thought I would show you how my face is looking now, 3 weeks on. You can see it's coming along nicely. All the swelling has gone down around here. I mean, this was quite a heavy duty procedure. It was very intense just because I had so many areas treated. And as you saw, I had that bruising coming up around my eyes. So that took a week to go. This swelling, you wouldn't have really noticed because it was just like a thickening, but now it's quietened down. I think you can see the collagen contraction that I got it feels much more solid under here already. So that's really exciting. But as for the full result, I've got to sit tight for another 2 months, 2.5 months, and then I'll really know what it's looking like. But that was this week's Tweak of the Week. I hope you enjoyed watching.